Here we go. Hi, I'm Barb May, Systems Developer at the College of Nursing. I'm going to discuss the use of mobile devices and the applications used at the College of Nursing. You should have UCentral and Skyscape installed on your device. This session will cover UCentral apps on your mobile device. There are 2 other sessions that will cover accessing and using UCentral on your PC, and another a session on how to use Skyscape apps on your mobile device. So let's go ahead and get started. It's not always how much you know, it's how fast you can get to the information. Pre-mobile device resources. They were hard copies, outdated before they were published, they were misplaced, there were multiple sources, so it was really difficult to figure out where you saw the information. So why do we use mobile devices in healthcare? Well, they're a lot more portable, multifunction. You can use it for cell phones, paging, communication, texting, access patient records. They have access to large amounts of information. You can view patient charts at your fingertips. You can have patient education information, and you can also link data. If you've been to your physician office recently, you know that they have access to the pharmacy, and they can actually send your prescriptions electronically to your local pharmacy, so there's not even paper that you need to worry about transferring back and forth anymore. How do you keep up with the changes? Well, in 2013, there were over 700,000 Medline citations. There were 39 new drugs approved in 2012, which was the highest in 16 years. That's a lot of medications to keep track of. And just last year, there were 27, which was still a significant amount. And with all the research being done, there's new genetic, cellular research protocols and other diagnostic tests, which is really difficult to keep track of and to know when patients are in research protocols and come to your facility where they're at and what medications and testing needs to be followed. So it's nice to have the electronic versions at your fingertips. Some of the challenges with mobile devices, especially with the College of Nursing, we have some restricted uses. You cannot put any patient information on your mobile device. This is a violation of HIPAA, Healthcare Information Portable Access Act. You can't have any photographs on there. You cannot post any information to your social media sites. You need to have your cell phone turned off. And at Ohio Health and Nationwide Children's Hospital, you have to use this in what they term the offstage areas, not in any patient rooms or hallways. The perception's been from visitors and patients that you're texting and using your phone for personal use, not necessarily for work use. That's why a lot of facilities have gone to using iPads or tablets, because those look more like computers and not necessarily that you're using them for personal use. So what can you do with your mobile device applications? Well, one of the biggest uses is to look at medications and to do calculations. According to some most current data, there's 1 medication error per day per inpatient. At least 25% of injuries from medications are preventable, and nearly half of all serious medication errors are a result of insufficient information about patient and or the drugs. So having your mobile device drug databases that are current, concise, and accessible than print versions, that can reduce all these potential adverse reactions and injuries and errors that can occur at the bedside. So you can look it up before you go in. What can you do? You can review test results if you're unfamiliar with the type of test, not just laboratory, but radiology or diagnostic tests. You can look those up when you're reviewing your patient's charts. You can look up information to teach your patient before you go in, and you can also look up evidence-based guidelines. These are constantly changing. For us, Unbound Medicine or UCentral, these are the applications that are available to you as a student. I will show you in the other session how you can add or take these off of your device if you're not interested in having all of these come on when you download your applications initially. But these are the ones that we'll be working with, and everyone that's a student associated with the College of Nursing has access to these applications. So let's go ahead and look at Unbound. All right, when you go home, you will see that you have a row of icons at the top of your page. So the first one is a Medline search. This is for your publications, and you can look up information just for general knowledge. The applications that you'll use in the clinical setting and for your just general knowledge for use for patient care are 5-Minute Clinical Consult, Davis Drug Guide, Pocket Guided Diagnostic Test, and Tabor's Medical Dictionary, and Evidence-Based Guidelines. So those are the ones that we'll cover today. So 5-Minute Clinical Consult is basically your disease, patient complaint, those kinds of things, general pathophysiological information. These, once you understand the layout of the pages in Unbound, they all work the same. So once you become familiar with one application, you'll be able to easily navigate through all the applications. So first, just to get oriented, on the left-hand side is the name of the application that you're in, and then it breaks it down by the sections that are located within each application. On the right-hand side, it gives you whatever section that you're in. It'll give you a description of that area. So for this one, when we open it, it gives you about the application, and it gives you the edition and editors and that kind of basic information. So for us, we're going to go in and look at topics, and this will give you just a general information arranged in alphabetical order. Now, what we're going to do is just look up a basic disease, and since this is in a hot topic in the news right now, we're going to go look up measles. And again, the more you type in, the closer you're going to get to your... So we're going to look up measles. So on the left-hand side, you'll see all the sections, and it has whatever one is highlighted in yellow is what's displayed to your right. And it breaks it down within each section, basic information that you can, they're tabs. So if you touch any of those, then you're going to go ahead and scroll down to that section on your right hand side. And of course you can always do the scrolling with your finger, so it's pretty easy to navigate either way you go. So for your purposes, you're probably going to want to look up just general about measles. So this tells you about what it is, where it comes from, and then now you look at the risk factors and then how to prevent it. So now we're going to talk about general measures, how to treat it. And then once somebody has it, it's kind of late for the vaccine. And then, of course, you're going to go ahead and do some patient education. So this might be handy for you to talk about for your to your patients. once you're caring for them. And then, of course, on this page also, another area that you can is a benefit are these cross links, the two arrows that go opposite directions. This will link you to any other place that the topic is mentioned in your other applications. So this is mentioned in your evidence-based medicine guidelines, and it's also, you can find useful information in your Davis Drug Guide. So those are the icons that you'll need to be familiar with. If you go to antipyretics, which is mentioned in the treatment section of in 5-minute clinical consult, it's going to tell you how antipyretics, it's a category, and just general knowledge about it. Now you have a back button here. It's going to take you back to your 5-minute clinical consult where you have your measles. So let's say you need to remember about measles because you're taking care of, you're in the community and you want to have this information readily available. So if you hit your star button, it's going to list it as a favorite. So let's go home, your home button, and now under your favorite you have measles. And if we click on that, it's going to take us right back to our favorite where we had it tagged. So this favorite is very beneficial if you're in a specialty area. Let's say you're taking care of pediatric patients and you're on a particular unit and you find that you're doing a specific kind of patient population. So you want to have that information readily available instead of having to go look it up every time. You can star it and make it your favorite, or you're an OB, or you're taking care of diabetic patients, so you can list those on your favorites. So let's say now you're in a different, you're on a cardiac unit, you don't want your OB patients anymore. You can unstar it, which will take it off your favorites list, or you do view all, and you click on it, edit favorites, and you can delete it by hitting the delete button. So again, you want to make sure that you have just the ones you need on there, or else you're not going to be able to find the ones you want easily. So let's go to the next one, which is Davis Drug Guide. This will be one that you'll use on a regular basis to look up your medications. So it's probably easiest to go to all entries. You'll type in the name of a drug. It can be either the trade name, which is the familiar name that you can usually see that we're more familiar with, or the generic name, which is the manufacturer's name. So let's do one that's on the market now that you've probably seen a commercial for, which is Abilify. And that is the common name. And you'll see here there's a blue button, and this would give you your pronunciation. You won't be able to hear it during my recording, but if you click on that, that will tell you what it sounds like. This also gives you a picture of it for identification purposes. And then because this drug does not have, here's the generic name up here, and then this is the trade name, Abilify. Wherever you see a blue lettering, it will take you to a link, and it takes you to another section. So you click on that, and this takes you to the classification of this drug. And this happens to be an antipsychotic drug. And again, if you go to your left, it'll highlight in yellow what section you're on, and then if you click on any section, it'll take you to that area and just keep moving you down. So let's go back to where we were for this particular drug, and let's see the contraindications and precautions. This tells you how to use it or it. And then the other important section is adverse reactions or side effects. So, adverse reactions, if something is in capital letters in red, that means it's a life-threatening condition. That if somebody has this, then it's pretty serious. So when you see these, when you're reviewing your medication, those are things you want to pay attention to. And then the next section, in the italics, that means that those are pretty common things that to expect, and that might be something that you'd want to just kind of warn your patient not to be too worried that might happen. The next section is your interaction, which is important to know that if you're on certain types of drugs, that you should be aware that if you're taking these two drugs together, what can happen, and that's kind of a red flag that you should be aware of and make sure that you read about. And then again, your teaching. Again, the red is something to make sure that you're aware of. Implementation is how you give the medication. So again, in the red letters, this can be a confusing drug by the name, so you want to make sure that you don't confuse it, and they actually give you that information there. All right, so you can do the back button, which keeps you within the section, but if you go to home, that will take you to your icons, so we can go to the next. Drug interaction facts. That's very similar to what we just did, but this is a quick way to do multiple drugs. So we can do the Abilify. We can pick that drug. Let's pick another Bactrim. Let's see if that has any. That's an antibiotic. And then we'll do, that's another drug. So right now we're not finding any. There. Now we typed in Tylenol. So of the drugs that we've typed in, there's a significance. So these two have an interaction, so you would click on that and it tells you the severity, and you can look and see the effects and just kind of be aware that this is a very quick way to look at all the drugs the person is on and see if there's any interactions or anything you need to be aware of. This was very useful, especially when people add new medications to their list of drugs that they're taking, either personal, family, or your patients. So it's a new application that's recently been added to our list, and I found it very useful. You can take them off, just go home, it resets itself. All right. Next one is your evidence-based medicine guidelines. This is basically what has been researched and found that works best in the care of certain illnesses or presentations. So let's say we have a, let's see, cardiology. That's what I was looking for. Let's see if we have, this is a slow heart rate. This tells you basically the essentials, just kind of general about it, and then it tells you what the best treatment is, and how it was researched based on the evidence, what the best treatment is. So again, this is acceptable, what physicians use to base their treatment on, how medications are prescribed, how treatments are prescribed, and everyone is on the same page and patients get better. Sorry, I didn't mean to close that out quite yet. This also gives you images, so as you're getting into different aspects of your cardiac physiology, this will also give you electrocardiograms, which shows you different presentations. This might be of benefit once you get into your advanced med surge. So just again, these are things that they just keep adding and become very, very beneficial. And just look out. And again, for our more advanced practitioners, these are kind of interesting. X-rays, just sound waves. This kind of information is just amazing that they can have all this in one place. So the next one is your pocket guide to diagnostic test. All tests would be your laboratory. All the ones listed below are listed in all tests. That's probably your easiest way to find something because it's kind of hard to know how it's listed. So if you just know the name of it. So let's do a bilirubin, which is a liver test. So if we type that in, it'll take you right in. Again, see how it's organized on the left-hand side. This tells you what the normal ranges are, how it's reported, and then interpretation, it tells you if it's elevated, what it would be elevated, what that means, and where you would see the elevation. Now again, look at your cross links here, and you would see that cirrhosis of the liver would be something the bilirubin would be ordered for. So again, you could go back and review that information. So let's go back and let's see, let's do some kind of x-ray. So let's do a chest. Chest radiograph. And this is just an x-ray of the chest. And again, it just shows, it doesn't really give a reading of this because there's so many different interpretations of that, but it does give you the name of it and why it would be done. So again, it gives you an idea of the types of indications and why you would do it, and then your preparation for this particular test. Okay, so the next one is your Tabors. And this one is a medical dictionary. So you would see entries. It goes A to Z. Pretty much there's a couple numbers, but not too many. So let's look up measles, since we were just on that. And you'll see there are different types of measles. So this gives you a pronunciation of that. It also has synonyms. This was pretty comprehensive here. And this one, it says prevention. It gives you a link to vaccines. So you can see all the different kinds of vaccines. Now this does have a table, and I'll tell you that tables show up pretty well on a computer screen or on a tablet, but they don't show up very well on a handheld device because the real estate on the screen is pretty small, so sometimes it's kind of confusing to look at those on a handheld, but you can see them. And then also you can see the cross links, and for this it only gives you, this is an unusual link here for neomycin. It's an antibiotic that you would use probably for any kind of open area on one of the open areas that are associated with measles, just to prevent infection. So let's go back to index. Tabors also has illustrations. These are not just pictures, but they're also diagrams. So as you're doing your health assessment, this might come in handy to be able to refer to some of these. It also gives you photographs as well. if you're doing, this was blood types, it'll tell you how those are determined. I don't know if you cover that in any of your pathophys. Here's your cranial nerves. Talks about, so you have a lot of pathophysiology illustrations within your tables. So again, that might be of benefit to have some audio visuals for you. There are videos in here too, so you can do, I won't show all these. I'm not sure if they'll show up on this particular one, but this is how to, this is a particular movement that is actually covered in one of your courses. It gives a pronunciation, and then it actually does a video on how to do it for shoulder. So it's not just a dictionary, it's a lot more than that. Then your appendices, there are some interesting ones listed in here. There are anatomy. These are all just listed. Goes through muscles, joints, nerves, cranial nerves, arteries, veins. So it's a scroll based on groupings. It's not pictures or anything. It's just listed for those particular areas, but it's a good review. The other one that is actually pretty handy is the medical abbreviations when you're first starting. It's kind of, some of this might be foreign language actually, and these are very handy. The disadvantages are not arranged in alphabetical order, so you just kind of have to scroll to figure out what these are. But especially for medications, you might see some abbreviations that you're not familiar with, but this will help you if you need to look it up. And you can probably look it up in your Tabers. Just type in the abbreviation, it'll look it up. So just this is a pretty handy tool as well. So let's just go in and do a couple of exercises real quick, and I'll show you how to use the application, just to review some of the things that we did. So let's our practice exercises. So the first one is, what's a life-threatening adverse reaction for Tamiflu? So that would be, we would go to our Davis Drug Guide, and we would do index, all entries, and type in Tamiflu. And we would look under adverse reactions, and we would see that seizures is in all capital letters. So that would be your life-threatening adverse reaction. Okay. The next one is, what is one preparation for a patient having an abdominal CT scan? All right, that would be a diagnostic test. So let's open that. And let's just go to all test, and let's type in abdominal, and it comes up abdominal CT and preparation. And we see there's 4 different types of prep there. And that's what we have here. All right. Whoops. Let's see. Laryngitis is inflammation, erythema, and edema of the mucosa of the larynx and/or vocal cords. Name 3 acute risk factors. All right, so that's a condition. So we need to go home and go to 5-minute clinical consult and go to topics and type in laryngitis. And then we need to go to risk factors. And these are actually divided into acute and chronic. So there's your acute. Okay. Now, the last thing you need to know, Unbound UCentral updates on a regular basis, and the Davis Drug Guide updates more regularly than the other applications do. So when you see up in the left-hand corner, there's a little two circles. If you see a red exclamation mark there, that means you have updates pending. So you need to make sure that whenever you see that, that you need to update your, go into your apps and do an update, and that'll load whatever ones are out of date, whether it's your drug or consult, it'll do all of them. So you just need to make sure you keep an eye on that, because there are different editions, and whenever there's an update, they'll release it, and you just need to sync it up, and it'll give you the most current one available. So that is how the applications work. They are rather easy once you figure out how to navigate. So if you have any questions, you can ask an IT staff member in room 260, or you can email the College of Nursing Information Technology at osu.edu, or you can email me at mays.45@osu.edu, or you can stop by my office at room 240, I'm sorry, my office is 343. So once you have all these downloaded, and just sit and play with them. There's always something new. Every time I use it, I find something that's of interest, and it just keeps getting better and better. But just make sure you use them in the appropriate area.